Good morning, everyone, and welcome. We are truly grateful that you're able to join us today. For those of you who were able to start your day off with a yoga session this morning, I hope you are feeling restored and now ready to engage in the informative sessions that are ahead of us today. My name is Shaista Malik. I'm the Executive Director of the Susan Samueli Integrative Health Institute at UC Irvine and the Associate Vice Chancellor for Integrative Health. We at the UCI Susan Samueli Institute are very excited to be co-hosting this integrative mental health conference alongside our community partner, Be Well OC. As all of us are aware, focusing on our own mental well-being as well as the mental well-being of those we serve, whether that be patients, students, families, community groups, or our own colleagues, is important now more than ever. It's part of our mission to serve our community through education and providing resources that address methods of improving whole person health. Whole person health requires addressing the root causes of disease, lifestyle modification, and patient empowerment. Well, what does that mean when it comes to mental health? So mental health is not something that only happens above the neck. For far too long, we have dissected conditions as mental health versus physical health, and that's how they're treated completely separately in our healthcare system. But mental health disorders like anxiety, depression, ADHD affect the whole person's health, their lifestyle, and general well-being. Our integrative health team strives to bring an integrative or holistic approach and strategies alongside conventional treatments. The goal is to treat mental health symptoms and simultaneously cultivate physical and emotional well-being. Integrative treatments such as supplements, diet modification, or acupuncture have a role in addressing mental health. Developing mindfulness, self-compassion, and positive psychology can decrease the impact of stigma found in mental illness, foster acceptance, and build resilience. The sessions today are all focused on integrative mental health practices that focus on the care of the whole person. We feel it's our responsibility as an academic institution to partner and lead efforts that address mind-body health within our patients and communities. Within the Orange County community, we agree that no one organization can solve the challenge of mental health alone. And so we are thrilled and excited about our partnership with Be Well OC, which is a novel model to bring all of us to the table and address mental health from a multitude of complementary approaches. And this really, we believe, will lead to comprehensive services that offer to our Orange County community the best in class care. With that, we would like to share a video from our county leaders that expresses the importance of today's integrative mental health conference. Thank you for taking the time to be here today.
Good morning, everyone. I'm Paramjit Joshi, and I'm the interim chair of the Department of Psychiatry and Human Behavior at UCI Health. And I'm so pleased to welcome all of you to the virtual Integrative Mental Health Conference that is being co-sponsored by Be Well of Orange County and the UCI Susan Samueli Integrative Health Institute. Today, you're going to be hearing from experts on a wide variety of topics, such as understanding anxiety and depression, how to deal with stigma, also learn about mindfulness and well-being. This collaboration between academia and the public sector is really extremely important. And I really want to thank Dr. Robert McCarron and his team for putting this conference together. As we all know, the COVID-19 pandemic has really had a huge impact, not only on our physical health, but also our mental health. And they're both equally important. So I hope you will enjoy the conference since there's much to offer. Thank you.
My name is Steve Pittman. I'm a member of the board of Be Well, and I'd like to welcome you to the conference that's starting, the Integrative Mental Health Conference, sponsored by Susan Samueli, Integrated Health Institute, and Be Well OC. And we welcome this opportunity to engage with the academic community to bring all that you know down into the field so that we're more effective with the people that we're working with. Thank you for being here.
I want to convey my welcome to everyone participating in this Integrative Behavioral Health Conference. My name is Richard Afable, and I am the president and board chairman of Be Well Orange County and Mind OC. And as a longtime member of this community, a leader of healthcare delivery, and as a physician myself, I can appreciate very, very well the significant challenges that we've all experienced in mental health, not just because of the pandemic and where we stand today, but also the challenges of mental health overall that have been present for many decades and requires a total community involvement. I'm very grateful for the UCI Susan Samueli Integrative Health Institute, who has partnered with Be Well Orange County in order to produce and create this conference that will go very, very far to bringing all of our collective thoughts together as we work so very hard to improve the general mental health of our community. So welcome to this conference. I know it will be a wonderful experience for all of you, and we really appreciate your participation and contribution to the mental health of our community.
Hello, everyone. I'm Eloise Gomez-Reyes, and I'm the Majority Leader for the California State Assembly, representing the 47th Assembly District here in San Bernardino County. I'm pleased to welcome all of you to the Integrative Mental Health Conference hosted by the UCI Susan Samueli Integrative Health Institute and Be Well OC Integrative Mental Health. My office and I work closely with UCI to help educate our community members in San Bernardino County by focusing on prevention and early intervention of common psychiatric conditions, and I'm also glad to see that this is also happening in Orange County. Now, during this ongoing pandemic, it is more important than ever to make sure we look out for each other and that we partner with our medical providers to reduce mental health stigma. This conference will help us recognize early signs of depression and anxiety while providing useful tips on how to stay healthy and prevent medical or psychiatric illness. This is an important part of healthcare that is often overlooked. I'm happy to see the essential collaboration between academia and our community with the goal of providing an integrative approach to mental health and well-being. This enables partnerships between patient and providers and will ensure that we squarely and successfully address healthcare disparities among underserved and vulnerable populations. Thank you once again for the opportunity to welcome you all today, and know that my office is here for you as well. Enjoy the conference.
Hi, I'm Congressman Ami Bera. I represent California's 7th Congressional District, the Sacramento suburbs. That said, I grew up in Orange County and went there for high school and went to UC Irvine for my undergraduate degree and also went to medical school at UC Irvine. I'm incredibly excited about being able to give a welcome video to the Susan Samueli Health Integrative Institute conference on mental health and well-being. It's incredibly important for us, especially in this time of the pandemic, to understand that mind-body connection. How can we as a community and a country and a world heal ourselves by coming together, by looking after one another, by thinking about how the things that we do, our mental attitude really does affect our physical attitude. You know, it's a super interesting area of medicine. And again, I'm glad that UC Irvine is working with the broader community to find these incredible discoveries. So thank you again for the work that you do at the Institute. I look forward to working with you and continuing in that work and supporting you from the halls of Congress. Be well, be safe, and let's be kind to one another.
I am Steve Goldstein, and I have the pleasure of serving as the Vice Chancellor for Health Affairs at UC Irvine. It is my distinct honor and pleasure to welcome you to the Susan Samueli Institute and Be Well OC Integrative Behavioral Health Conference today. The Susan and Henry Samueli College of Health Sciences, UCI Health, and the UCI Centers and Institutes of Health, altogether, UCI Health Affairs, are dedicated to improving the human condition through the best in education, research, and care. Our physicians, nurses, pharmacists, population health, and integrative health providers have been dedicated to supporting Orange County in confronting mental health, and notably dealing with depression throughout the COVID-19 pandemic. We are proud of our partnership with Be Well OC, bringing together a robust, community-based, cross-sector strategy, public and private, to create a coordinated ecosystem to support optimal mental health and to manage mental illness and addiction effectively. Together, we can all act as one to protect and serve in Orange County. So thank you for taking the time to join us for this very important and timely discussion around current research on depression and anxiety that has been amplified during the pandemic. Our presenters have an exciting lineup featuring an introduction to mindfulness, yoga therapy, as well as some of the other resources we bring to treating the whole person with a focus on lifelong wellness as well as disease management. Please stay safe and enjoy the conference.
Hi, everybody. My name is Marshal Moncrief. I'm the Chief Executive Officer of MindOC, an entity that was created by the Orange County community for the Orange County community to unify all of us in creating a world-class system of mental health care for all residents of this community, known as Be Well Orange County. And I really appreciated listening to the opening speakers just now and Dr. Goldstein's comments, in the way that COVID amplified the already existing challenges of depression, substance use, and other mental illnesses, but also the way in which the only way we'll succeed in successfully addressing these things is together. And that's what Be Well Orange County is all about. And so Be Well Orange County is a robust coalition, community-wide, representing all the sectors of Orange County. The public sector, the private health sectors, academia, faith community, private business. It's really the stone soup of building a mental health system where everybody, every sector and organization has something to contribute to pull this off. And we're well underway. You know, prior to COVID, depression, addiction, and the related challenges of homelessness and suicide. All four of those were considered individually to be at epidemic levels. And COVID really exacerbated that. And as Dr. Goldstein said, it amplified that. But COVID amplified something else too. It amplified our resilience and our resolve as a community, and it amplified our awareness through experience of the way in which we have to continually seek each other. We have to continually seek each other out and strengthen our sense of community in the best interest of all of our health, wellness, and resiliency. And that's the only way we can do it. So it's just a massive honor to be partnered here with UCI, who has really led the way for a long time with that in mind. That community connection in mind long prior to COVID. And I think it's a particular honor to be doing this conference today in partnership with the Susan Samueli Integrative Health Institute, because the Institute and the leadership of the Institute so beautifully express that commitment to whole community connection for whole person care. And so my thanks and gratitude to Doctors Shaista, Malik, and Robert McCarran for your leadership and your vision for conferences like this, and helping to keep all of us connected in the best interest of all of our health, wellness, and resiliency. So thank you. I also have the pleasure of introducing somebody, our first speaker today, in fact, our first topical speaker. And this person is very close to me. I consider him a brother, in fact, and he was a critical co-founder of Be Well Orange County. And I'm talking about Dr. Clayton Chow. So Dr. Chow, a few years ago, along with myself and several others, including leadership of UCI, as we got together in a room to start talking about how we could better unite our community to create this world-class system of mental health care. Dr. Chow was a real visionary leader of that and just essential in our building of it. And I remember the day when I got my Dear John letter from Dr. Chow. It was the Dear Marshal letter that he had a calling and needed to move into a new position outside of Mind OC. And it was hard to hear that news. And yet in retrospect, it was probably the best thing that happened to the Orange County community. Because when COVID-19 hit and all of us were kind of staring stunned and trying to scramble to see what we might do, the county called on Dr. Chow, on Clayton, to step in as the county's healthcare agency director, which he did. And I can't imagine anybody stepping into that role at such an extraordinary time and leading all of us across the community with such courage and such grace and such vision and commitment to excellence in executing. And Dr. Chow did that. I've got a mentor of mine who said some time ago to me that of all that's great in the human being, our greatest asset is our ability to grow and change. And I think we did that as a community. We grew, we changed, we came together. And very much of that was due in that extraordinary time to Dr. Clayton Chow. And so I am very honored to introduce my friend and brother, Dr. Chow, the king of Orange County Healthcare Agency and the prince of public health, Dr. Chow.
Thank you so much, Marshall. Good morning, everybody. Marshall, thank you for that introduction. Gosh, I was just sitting here thinking that you probably talk about somebody else. You just do the work, serve the community, and don't think twice about it. And I think all of us here in this room, the panelists as well as the attendees, I think collectively we have put our efforts in there to really care for our community, care for ourselves, for our family, and our neighbors. So with that, I thank you for all that you've done this last 20 months. I have the pleasure of starting this conference by giving you a brief update on COVID. And when Dr. McCarran said, and you only have 15 minutes, last night I started to panic. What can I tell you in 15 minutes? But I'm going to try and talk about issues that pertinent to the mental health side of COVID. So let us start out with stats, because I think stats, the statistic, bring the human side of this pandemic to all of us, because much of it has been so politicized this last 22 odd months, as you know. And so I've always give my talk by starting out with the statistic, because it will bring to you, close to your heart, the human effect of this pandemic. And clearly for all of us who providing social and human services, or even people who just volunteer to provide the care for the community, this has been an extraordinary time. And although you probably heard many, including myself, predicting that if we don't change the way we care for each other, if we don't change the infrastructures of our health system, we will see another pandemic in the next decade or so. And so here it is, this last 22 months worldwide, there have been 265 million positive cases and close to 5.3 million deaths. 5.3 million deaths. In the US alone, we have 50 million cases, and we already surpassed 806,000 deaths. More deaths than any other wars combined in the history of the US. 806,000 deaths. In California, 5.1 million people have been infected, and there have been 75,000 deaths in California. Orange County alone, we got 335,000 cases that tested positive, and we do know that overall, though positive cases is probably underreported because there have been people who are asymptomatic and therefore never get tested. But in Orange County, we have lost over 5,700 deaths, 5,700 deaths in Orange County alone. And every week we do have people continue to die. And that's the saddest piece currently, is that people continue to die, people continue to be positive. And we've seen the majority of those folks are individuals who are unvaccinated. That's the key point, that the spread of the virus continue among those who are unvaccinated. And you probably have heard the newest variant that raised concern on the eve of Thanksgiving weekend. WHO talk about Omicron, which is the variant of concern. As of this morning, Omicron has been found or tested or identified in over 27 countries in the world. In the US, we now have 10 cases that we know of, spread across 5 states, with New York have 5 identifiable cases. But California was the first, at least we know of, the first state in the union that have our very first case, and San Francisco had our very first case early on this Monday, followed by LA with another case identified yesterday. And then the other 3 states each has 1, and those are Colorado, Minnesota, and Hawaii. But you do know that we're not only having 10 cases, it's just that we've not have enough time to sequence all the positive cases within the last week to 10 days. I suspect that the number will rise in a day or two. It speaks to the importance of really get the vaccine, get vaccinated. People always said, well, you know, Omicron seems like it's not as severe as the Delta, which, by the way, continue to be the majority of the cases here in the US and the world. However, and there are people who suggest that maybe you don't need to get vaccinated, people just need to be infected. That's not the point, because people always argue that maybe you just develop natural immunity to help us reach whatever the term herd immunity is, which has been not talked about anymore because it really doesn't make sense to talk about herd immunity at this stage of the game. And so we do know that as long as the virus continues to spread, it will continue to mutate. And it's the mutation that we don't know what the effect will be on our population. And therefore, the argument that let natural immunity to occur is absolutely false. And so I just want to make that point. Let's talk about the virus. We do know that we are not made to be in isolation. We know that. That's why this last 22 months have been devastating for the human race. Across the globe, you've heard of story of people who suffer from anxiety, depression, because of that isolation, because of those lockdowns, which were necessary and will continue to be necessary for any area that have high outbreak. We've heard about increases cases of addictions, particularly opioid addiction. We have more opioid death and ID this year than the last 5 years from an annual basis. That's the concern. We hear people talk about the long haul syndrome, or long COVID syndrome, or post-COVID syndrome, which occurred about approximately a quarter of the adult population and perhaps 1/5 to 1/4 of the children. Some of those symptoms that related to the brain is fatigue, brain fog, difficulty in concentration and thinking, anxiety, depressions, and particularly in children, we have had more cases of kids who develop hallucination and delusion, even though they had no previous history of mental illness, nor did they have any family history of mental illness. And so we do know that it is directly from the infection, the cause of the infections. We do know that children have difficulty in concentrating in school, and therefore it's decreased their performance. And so while a lot of folks said, well, for children, COVID is not that bad, and that the number of kids who passed away from COVID in the US, even though over 4,000, nothing compared to the adults. I always said any life lost is one life too many. But the important thing here is that we don't know what the long haul syndrome in most of the kids would be. In Orange County, we have started a project. Pretty soon, we will get to our over 30-some thousand kids in Orange County that have been diagnosed with COVID, to get them into testing and make sure that we identify their mental health condition early. So those are the long-term side effects of COVID, beside the typical hospitalization, ICU PTSD, or ICU psychotic delirium symptom, and cognitive dysfunction that we see for any health condition. Currently, Orange County, we do fairly well, and again, due to the collective effort that all of you and the community have been doing for the last 22 months. I just got the statistics today. As of today, this morning, we are at 5.7 positive cases per 100,000, and our positivity rate overall for the entire county is 2.7%, and the positivity rate in our lowest SES quartile, commonly referred to as the equity metric, is about 2.8%. As of yesterday, we have 176 people in the hospital, and that number has been stabilized somewhere in the high hundreds, close to 200 week per week for the last month or so, with 55 of those individuals in the ICU. And again, as I mentioned earlier, the majority of the cases in the hospital continue to be individuals who are unvaccinated, and the majority of the positive cases continue to be individuals who are unvaccinated as well. We have seen some data in Omicron from South Africa and the first 10 countries or so, that there are some cases of people who have had previous variant infection, but also have gotten Omicron. And clearly, as you probably have read the news yesterday, in Norway, there was a gathering of 60 individuals, and I think well over 57 or close to 60 of them now have been tested positive for Omicron. And so that's the largest outbreak that we have seen so far from this variant. In terms of treatment, we do know that we have very limited treatment, with one approved antiviral and two more in the wings, and there have been some issue with the side effects of one of the antivirals that are being reviewed by the FDA. But the exciting thing is related to mental health, is that there is a randomized clinical trial on the use of fluvoxamine to treat COVID. And the preliminary data shown that compared to the placebo arm, fluvoxamine seems to decrease the risk of hospitalization. So that's exciting news. The FDA also have authorized 5 monoclonal antibody infusions, and There are more in the wings. The the guidance that we continue to push out in the community is, number one, get vaccinated. Folks who are eligible for the booster should get the booster shot. And as you know, as recently as last week, the CDC have now recommend that people should get the booster shot if they are 18 and older. Get vaccinated, continue to test yourself, especially when you're exposed or you know that you think that you've been exposed. If you travel and you come back, make sure that you get tested regardless of your vaccination status. Masks continue to be important. Hand wash and distance yourself, especially when you are around strangers whom you don't know their vaccination status. In Orange County, we follow the guidance of the state and the CDC, but my message has always been, please know your risk and do the right thing, right? If you yourself fully vaccinated, but you live with somebody who has high risk, or you yourself have high risk, just be aware of your environment and do the right thing as it relates to masking, as it related to hand wash, and as it related to distancing. We do need people to get vaccinated. In the U.S., one of the richest country in the world, with excess, that's the term I'm going to use, excess vaccine. And we only got about 71% of the U.S. population have seen one dose, and we're only 59.6% fully vaccinated. In Orange County, 76% of the Orange County residents have seen one dose of the vaccine, and those who are eligible, 69% who are fully vaccinated. There are countries in the world, especially in the African continent, where the vaccination rate is less than 1% because there's no resources for folks. I know my family and friends that live in Asia, particularly Southeast Asian country. People are dying, people are wanting vaccine, but they have no access to the vaccine. Whereas in our country, we have to throw vaccine away. We have to beg people. We have to give away millions of dollars to convince people to get vaccinated. So I beg all of us, if you know friends, colleagues, neighbors who have not been vaccinated, have a conversation with them. Share with them resources that give the evidence-based medicines around this vaccine and not the misinformation or disinformation that's out there in social media. So the last piece is, people ask me, are we expecting another surge this coming winter? Are we in winter already? Checking out the window. And the answer is yes, we will see a surge, but the surge will be among individuals who are unvaccinated. And now the surge this coming winter might not be the same magnitude as the surge in the early winter 10 months ago, but we got to talk about the system that are supporting the surge, right? What I'm talking about is the healthcare system that we have. The box that we call healthcare system is much smaller now compared to what we had not 10, 11 months ago, because people are tired. My concern is the well-being of the provider, the healthcare provider. Healthcare providers have suffered from fatigue. They've suffered from PTSD, depression, anxiety. And what I'm most concerned is this ethical and moral dilemma when you have providers struggle dealing with people who continue to show up in the hospital, continue to show up in the healthcare system, very ill and unvaccinated. And so the issue of there is something we know can get us out of the pandemic is called the vaccine. But why are people struggling with it and continue to get very sick and continue to die? I think that is the moral, ethical issue that our healthcare community will be struggling with. I know as physicians, as nurses, we take a Hippocratic oath that we will treat people, we will care for people, regardless of their background, regardless of their personal decision on adhering to treatment, accepting treatment, and what have you. But my concern is that for a not insignificant number of healthcare providers, they are suffering from that issue, and they will continue to be. And so, for the provider out there, we want to remind the provider of our obligation to care for individuals regardless of who they are and what the decision is around this pandemic. But the advice is take care of yourself. Self-care is very important. Practice mindfulness. I'm so happy that we have a session on mindfulness today. And then really, you have to worry and you have to be mindful of your own well-being, of the well-being of your family, of the well-being of your neighborhood, and of the well-being of our community. So for our healthcare provider, for our human services provider out there, I thank from the bottom of my heart for all that you have done this last 22 months and for all that you will be doing to ensure that we save life, because every life lost is one life too many. So with that, thank you so much. Back to you, Marshall.